Good evening, everyone. Hope I am audible. Yeah. Today we are having this introduction to the World Health Organization course on COVID-19. As you all know, since December 2019, Corona, it's a virus impacting globally, and the pandemic is continuing. And now we have Omicron, BF7, another variant which is spreading very fast. And millions of people are already affected. And there is health crisis globally as of now. And in the last, these 3 waves, everybody saw somebody in their own family or very close to got impacted. And now some related people also expired due to Corona. And you all must have gained some knowledge already. But this particular course offered by WHO, which also gives you a certificate after attempting the quiz and getting the minimum marks. This is an open MOOC. The web link of this open who.org, that's the website. Hope you all have gone through the link provided already to join today's course, that is Introduction to COVID-19. Yeah, I'm sharing the screen now. This particular course, just a second. Hope you are able to see the screen.
Yes, sir.
Okay. So here, this particular course, Introduction to COVID-19, Methods for Detection, Prevention, Response and Control. So in this course, it is a self-paced course. We have 6 modules. And within these 6 modules, you have assignments for 5 modules. And under each of these modules, there is text. There are videos as well as some PowerPoint presentations available. So you could go through all these 3 materials. Even by going through the videos, that is enough to attempt the quiz. And in this dashboard, you can see, please mute yourself. You can please control them. Yeah. Yeah. This we have learnings in the dashboard. So these learnings and discussions also is there, and progress is there. Some progress you can know, like 100% means I have already attempted this course, that's why it is 100%. So you have to go through all the material that is given, how fast you go through or how slow you go, through, that depends on you. So this progress will indicate whether you have read the material or you have attended the quiz. Then only you can go to the next level. And here getting complete marks 150 out of 150 marks, then you will get a certificate with which you could download. So let us go module by module, and I'll introduce you to this course. So in this initially to log in, I hope it is very easy. You create your own user ID using your Gmail account or something, or email account. Then create your own password and give your name exactly as you want it to be appearing on your certificate. So that's very easy, and you could do that. Then here, module 1, when we go, I'll show you how it appears, the dashboard. So you can see there is a video here because I clicked on this symbol. And if you click on this symbol, then about this course, some information is there. That is, it is said that you'll be able, you should score at least 80% of the points in the quizzes. And above, you have this, the record of achievement can also be downloaded as open batch for this course, which you could publish. So here, introduction to, in module 1, it is on introduction to emerging respiratory viruses, including COVID-19. So here you have seen this video. So each video will be like about 10 minutes to 15, even 20 minutes. Here by clicking, you can also go and watch the same video on YouTube. From here only you have to go. Then you can also download the videos in high density and SD, and also presentation slides as PDF. Actually, this will be very convenient if you want to go line by line, the PDF files. Also, you have audio file, which you can download and listen to. And also there are some discussion groups under each module. From various countries, people will be asking some questions and there will be replies by the community. You can reply if you know the answer, or if you want to ask something, you can ask. So this is also there. Then after this discussion, you will get to there is quiz, you can see below. After introduction, then module 1 quiz and discussion. So by clicking quiz, you will go to quiz directly. So here I will be showing you to download this PDF, let us say, because in your videos you can listen to me. There is very good explanation, and this is the PPT in the form of PDF. So all the details are given, like emerging respiratory viruses, the history of the viruses, how do they emerge, and who are at most risk, how to protect yourselves. And viruses continue to emerge and pose a challenge. The historical sequence is also given, like it started in 2002, SARS-CoV, and then 2009 H1N1 influenza, and 2012, and 2019 onwards, we have this COVID-19. Otherwise, it is called SARS-CoV-2, novel coronavirus also called. And we have various variants like Delta, a major variant. Another major variant is Omicron. Now within Omicron, we have BF7. Then human health, animal health, and the status of ecosystem. This is very critical because of communities who live with animals, and this is called zoonotic origin because they are mutually transferable between animals and humans. They are transmitted. So from animals, sometimes they remain within any animal for a longer period, but like spillover, it comes out and impacts the humans. So various animals which are domestic or wild animals could be responsible for this situation. And this is severe acute respiratory syndrome, SARS means. Then SARS-CoV-2, this is called novel or new coronavirus or COVID-19, what we are calling. So we are naming them simply because scientific names will be very difficult to remember. And it comes from a variety of animal species, like civet cats in China in 2002 or 2003, or camels in Saudi Arabia in 2012. And that's what the spillover event is, when a virus that is circulating in animal species found to have been transmitted to humans. This is again, you see historically the time-wise what happened, especially from 2019 onwards. In December, we have seen in Wuhan, especially the coronavirus, and then World Health Organization by 1st January, they got into this management team, and by March, WHO declared COVID-19 as a pandemic. And since then, you could see globally how the cases have gone, and the deaths also you can see occurring every month. And country-wise also you can see which region-wise you can see which areas got impacted the most. So as of now, this is a old presentation. You could see 7th October 2020, but latest data is also available because this course was prepared long back. But latest information from WHO website, you could see exact numbers. Then symptoms are like fever, dry cough, shortness of breath. Of course, we have like diarrhea, loss of taste or smell, and discoloration of fingers or toes. This is also happening. So other things you could see, especially pains, headache, conjunctivitis. And sometimes clotting also happened, blood clotting. And it also led to cardiovascular challenges like heart attack and other things. Usually symptoms are usually mild, and those who are mild, sometimes they may not even know that they got infected, and without hospitalization also they could recover. About 20% people have a problem actually. It is around 1 out of every 5 people, they become seriously ill. Older people are more vulnerable. That's why we have seen in Italy and some countries where aged population is there, they got impacted in spite of so many facilities there. And those with historic like high blood pressure, heart lung problems, diabetes or cancer, they also have high risk of developing serious illness. Then how this virus is transmitted from one to another, it transmits. And this transmission also like droplets when we sneeze, and the infected from aerosol transmission, from where it infected. So especially through eyes, nose, and mouth. That's why we said people to use sanitizers and or use mask, uh, especially to clean hands and all that. We uh, already this what precautions need to be taken, and Government of India also issues those regularly, the rules, especially the social events, or what they called social distance, how much we need to maintain. So especially in crowded place, it gets amplified, and within families also we saw if one person got infected, the whole family got infected, because quarantine and other facilities are not available in families, and sometimes apartments and some colonies, some areas, they got infected where they stay very close. So here, family members, even healthcare workers, they also got infected, and proximity is one issue. Here, that's what hygiene we need to practice, cleaning our hands and all that, and respiratory hygiene. Like at least use your elbow, lift it up and then sneeze, like, or use mask continuously. So like using tissue papers and 1 meter distance. Then avoid crowded places, close contact settings. Open a window or increase the amount of fresh air. And this mask, which is medically recommended, only that we have to use. So anybody having similar symptoms, keep away from them like that. So this is module 1. So once we get you here at module 1, so quiz you can see already I shared some guidance answers, so easily you could pass once after getting that material. Here already I have attempted, so here I could attempt again if, but you see the results already taken the quiz. So here you could see zoonotic diseases are diseases that are naturally transmitted between vertebrate animals and humans. That is the correct answer. The percent of emerging and re-emerging infectious diseases of zoonotic origin is estimated to be 70 to 80%. So once you click here and then submit, then you get whether if it is correct or wrong, you get with this green color. Once all are correct, you get all green. Then if anything goes wrong, you can retake the same quiz. So because once you attempted, you know the answers or you have read the material. So next time when you attempt, you will be correct. So you'll get, I'm sure everybody will get all the marks, 100% out completely. So this is how you have to attempt your quiz. So we have gone through the material and we have gone through the quiz. And now that is module 1 is completed. So hardly it takes 1 hour for you to complete this course, because given you already have some knowledge about corona and the challenges. This is module 2. So it is on enhanced surveillance and outbreak investigations for emerging respiratory pathogens. Surveillance is a kind of monitoring. So here again we have this PDF. So you could see, see here enhanced surveillance and how to conduct outbreak investigations in different settings. That's what you would learn here. So to prevent further spread, this is very essential. Actively find cases through case and outbreak investigation, conduct enhanced surveillance. So how to find it? So if there is a confirmed patient, then healthcare providers who take care or clean the room, and social or familial and work contacts of the infected patient. So all these are vulnerable. We have to search and find. Earlier it was like 14 days. Now it is very fast. Means if a person had a contact with a COVID infected person, after 14 days we used to see the symptoms. At least means some time was there. So that's why those who had international travels and all that, the government kept them for about 14 days in a quarantine situation. So 2 days before and 14 days after the onset of exposure. So within this, it will be confirmed whether that person who made a contact got it or not. So other things like, as I said, the distance or direct contact whether with the patient that person had and all that. Yeah. So here we have to identify this was the database. Initially we had complete database that is from one person, how many people it reached and who is that person, like that. So like name, contact and demographic information, date of first and last exposure. Now we are not maintaining this kind of intense information. Earlier the government was taking care, especially immediately after the first wave. So this is a kind of flowchart how to identify contacts. So every new person made contact with the infected person for 14 days time. Within that, we need to monitor whether within 14 days the symptoms will appear or no symptoms will appear. So like that. So if symptoms appear, then we have to take the test and then isolate and then give medication until they get the negative test. That is RT-PCR test, And if positive, again we have to identify those persons who are in contact with this person with symptoms again. So it goes like chain reaction. So this was a very lengthy process, but now majority are getting infected, and in spite of so much zero tolerance regarding this corona, China had followed very strictly. But last month, because of certain incidents of this policy, there was lots of agitation. So government of China gave up. So now suddenly we see the surge in millions now got infected with this. Please mute yourself, whoever is talking. So here we need a multidisciplinary team with expertise. That's why you all will be part of this pandemic, contributing or supporting, especially those who get infected or under preventive care you are working, or many ways we can work, directly or indirectly. That's why this knowledge is essential. But otherwise, there is a close team with like field epidemiology, clinical assessment, biological specimen collection, infection prevention and control, risk communication and community engagement. So this risk communication and community engagement, anybody can participate. And the animal health specialists, they look into the data of the animals. So they had to gather all kinds of information, and the surveillances are very essential, and even necessary materials and supplies. Now we see especially vaccines was the big challenge globally, and many people got vaccinated now once or twice. And please mute yourself, whoever is unmuting. Yeah. So here necessary materials, equipment, even tablets are also in some. Hello. Yeah.
Sir,
Yeah. Why it went off? I don't know. Okay. So we have to inform this, identify other cases and quickly detect any human to human transmission. So here actually we have to reduce the onward transmission and reduce the morbidity and mortality through rapid identification, isolation, and all that. And also I need to identify the geographic area in which the virus is transmitting. If somebody is unmuting themselves and not behaving properly, please put them out. Like Monica, it is not right. You should know what you are doing. Please take care of yourselves. You all attend so many Zoom meetings. Okay, don't unmute unnecessarily. You have to take names and you have to keep in waiting room directly. Or block them if they are unnecessarily disturbing. Determine the size of the geographic area where it is being transmitted. And so all this comes under the surveillance. So field visits to investigate the occurrence of illness among animals can include the patient's home and its surroundings, live animal markets or slaughterhouses, or any other place the patient has visited in the last 14 days. So all these things are part of this multidisciplinary team. So data is very critical, but in pandemic situation, when it goes beyond, even these things are of less use because it goes. So only thing left is like taking precautions and vaccination and other things are there. So similarly, you have the quiz, so you can attempt this quiz. So here, just a second. Okay. So here in this quiz, you see because again I have attempted already. So you'll see the questions. Which of the following is an example of active case finding? So actively searching for cases in healthcare facilities where infected patients were cared for. So that is the answer. So 14 days, you know how long to do contacts of a confirmed case need to be monitored. It is 14 days. That is the correct answer. Outbreak investigations require a multidisciplinary team. That is true. Which of the following are key components in the descriptive analysis? Time, person, place. Income is not there because the corona impacts equally everyone. So that's all. If you answer all this, then you get 100%. Okay. So now this module 3, that is detecting. Module 3 is about laboratory investigations, basically, how it is done and all that. So let us go to the PDF file. So here people with symptoms and testing and retesting and all that. Well, so here people would know like types of sampling methods, those who do this course, and type of laboratory investigations used to confirm cases, you would know. So it is infection could be laboratory confirmed. So by detection of viral nucleic acid, this is done. And by possibly using serology to demonstrate antibodies. So here, like we take for PCR, RT-PCR, what we say, we take different things for this particular study to understand whether a person is infected or not. Like sputum, lavage, aspirate, and even nasal mucus, it is taken. And samples should be taken within 14 days to see those who made a contact. Then PPE kit is what we were wearing, you remember. It's a complete from head to like our shoes level, including gloves and mask, and everything is part of PPE kit. And safe handling practice and decontamination procedures are followed by them. And when they collect a sample, it should reach the laboratory at 4 degrees centigrade. It should be stored and within 72 hours. If it is testing place is far out, then it is like minus 8 centigrade is there to. So sometimes negative results might be obtained from an infected individual. So that is because of poor quality of the specimen. The specimens collected late or very early in the year. The specimen was not handled and shipped appropriately. Technical reasons inherent in the test, virus mutation or PCR inhibition. So if a negative result is obtained from patients with a high index of suspicion for infection, new specimens, including some from the lower respiratory tract, if possible, should be collected and tested. Laboratories that have not validated their capacity to detect coronavirus should send the first 5 positive, the first negative sample to one of the international reference laboratories. So this is a small thing, especially this module. And here the quiz is also very simple. So here you see, if a negative test result is obtained from a patient with a high index of suspicion for infection, new specimen should be collected and tested. This also you have to follow in your personal level, that is true. Because for the reasons, if sample is not collected properly, or it is sent for testing late, like that, all the reasons which a negative test result could be obtained even if an individual is infected because of the following reasons. All the 3 reasons above. as just before I said, like poor quality or very early of illness, and it was not handled properly. That's all. If you attempt these two, this piece is over. Then module 4, we have risk communication. So in risk communication, especially how do you communicate the risk? Risk exposure. So describe the risk communication concerns for emerging respiratory viruses, health advice, how to take, and identify key interventions for operationalizing risk communication during an outbreak or event. So the real-time exchange of information, advice, and opinions between experts and officials and people. How does it happen in all that? So everyone is at risk and informed decision making to mitigate the effects is required. Domains: communication and social science intervention, mass communication, community engagement, and interpersonal communication, all are required. So we require communication at all levels, whether it is a preparedness level or early detection level, containment level, or mitigation level. So we need the scientific communication or real communication. There will be lots of fake news and other things. So we have to here authorities and spokesperson, healthcare workers, hospital management personnel, NGOs and community organizations, influential individuals or groups in the community, travel and tourism sectors, animal health officials. So everybody they send these messages. So target audience is everyone again. So nowadays with social media and WhatsApp groups and other things, this communication is happening very fast. So here many questions will come and what is the message to be given? They frequently clean hands by using alcohol-based hand rub or soap and water. If a message is given, then supporting messages: avoid touching your eyes, nose, and mouth with unwashed hands. So like that, all the details of precautions to even mitigation level are given in this communication. So most of these things you know because this was being taught in the last 3 years. Okay. And ultimately be proactive in information dissemination with frequent updates that is required for you all. Like now, Omicron BF7 is very close to us. Don't imagine it is now in China, in Japan, in South Korea, in Europe, in America, in Canada, like that. Within no time, it will reach. It happened earlier also. So be attentive. Already government is also playing a role in communication. Right from the Prime Minister level, all media has covered, especially special news on this virus now, what is happening now. So you could also play a role. With this knowledge, with this course, and there are several other courses in Open WHO, you can learn a lot and then you could communicate. So that way, you could also help the local communities and the civil society. So there is again a quiz in this risk communication. This is the module 4 quiz. Culture and traditional practices may sometimes be a barrier to the uptake of health advice. That is true. Because if people are said use a mask, they were traditionally not using, let us say. Then suddenly, in Japan, that's a culture. They always use mask. So that could be a barrier when we inform others. So here again, which of the following are good risk communication approaches? So these three are there. In an outbreak where knowledge about the virus evolving, health advice must be stated with appropriate uncertainty. Health messaging should be consistent across several channels. Health message should be tailored to the target audience. Then rumor surveillance is not important during an outbreak. That is false. Rumor surveillance is very much required because we should not believe rumors. Yeah. So this is actually only a kind especially in module 4, this is not counted. This is like a bonus kind of thing. So, but still you can attempt. Then community engagement is very, very important topic. You can go through the video. And here, because pandemic means it impacts the whole society, then you need to engage communities during the outbreak and the challenges faced by the community engagement and effective community engagement, detecting, preventing, and responding to an outbreak. All these are required. So affected communities and populations need to know how to protect themselves, and the response teams need to know how communities understand the disease and response. Okay, so population that respond and must be a part of the solutions to protect lives and stop an outbreak. So again, community engagement is required at all levels, like in communications, from preparedness, early detection, containment, and mitigation levels. So lack of understanding of community practices, concerns, and fear by response teams. Slow or late information release about the disease. Lack of information and awareness and protection measures. So like that, all these are important. So this is also an easy chapter for you. So let me come down to the quiz. These are community questions which you can go through. This is a compulsory quiz actually. Module 5. Module 4 is optional. Key reasons that responders need to engage communities during an outbreak are, especially for engaging with communities, allows their direct participation in the response to address fears, barriers, and concerns. That's right. Then response teams need to know how communities understand the disease and the response. Then generic public or media announcements are not sufficient, trusted, or tailored to community interests. So these three things are correct. It will increase community donations to fund the health response. It is not correct. Community engagement is not for funds. Then communication involves sending and receiving information. That is true both ways. Communication is not one-sided. Okay. Then here, the module 6. Module 6 is on preventing and responding to. It is infection prevention and control, basically, and clinical care. So this is again, you can go through this PPT. So here, how do we prevent finally? Here we would learn preventing infection in the community and healthcare settings. That human to human COVID-19 transmission happened both household and community settings, both. Say you have gone to a shopping place, there you got impacted, and at home also somebody went outside and came. So avoid agglomerations and frequency of closed, crowded spaces. Maintain distance, it's already there. Even right from module 1, we are learning some of these things. Then cleaning your hands, hygiene, alcohol-based, because that can sanitize properly, soap and water. coughing and sneezing, what to do, how to do. Okay. And refrain from touching mouth and nose. Okay. Then individuals with respiratory symptoms should wear a medical mask and seek medical care if they have fever, cough, and difficulty in breathing and all that. So again, healthcare workers may be at risk. Again, they have to take care. Okay, then again, precautions for all patients in all settings and all time. Those who are patient already, they have to maintain all this. Even PPE kit means personal protective equipment that they have to wear, and safe injection practices like that. Then environmental cleaning, waste management, linen management, patient care equipment, it is to be taken care. Early recognition of patient with COVID-19 have a high level of clinical suspicion of COVID-19. So like that. So here again, maintaining distance and all that you know. Here ventilation especially should be there. You see the pictures also, it gives a good picture. And while sneezing and coughing, you have to dispose the tissues also after use. And this when admitting patients to wards, ensure that only those with confirmed infection are placed with other COVID-19 confirmed cases. So we should not mix the patients. So that's why we have corona-specific hospitals. They were demarcated, including private as well as government. And especially droplets, these are very dangerous. They lead to transmission. So droplet precaution is through masks and keeping the patients at a distance, or even eye protection also. So medical masks, again, face shield or goggles, gloves, gowns, all that are required. So there's especially PPE kits which were in use when we especially contact the infected person, even visiting that person if needed. We have to take care. Then disposability, how it is to be done. Or you have to keep dedicated equipment, even at doctor level, stethoscopes, blood pressure and thermometer and all that. They should be used only for the patient. If you need to be shared among patients, then it is to be disinfected and used. And the care workers should not touch their eyes, nose, or mouth unnecessarily, even potentially with the contaminated gloves or ungloved hands. Door handles and light switches, even lift switches also, they're the cause. And always clean the surfaces. Then ensure adequate room ventilation, use single rooms or cohort. Minimize movement or transportation of patients. So open, generally good oxygen flow should be there. Otherwise, most of the patients, those who have a severe condition were given oxygen. So preferably live in the natural condition where lots of ventilation is there, greenery is there. That's better than artificially taking oxygen, and even moving away from the most polluted cities is another better precaution. Then we saw the high cases in highly polluted, especially air pollution is very high during winters. And it aggravates the problem. And even industrial areas where people's lungs are infected and we have already lots of pollutants in the air. And there also the cases were high. So keep away from such places. So N95 is a kind of mask we have to use. And Then these ventilated rooms, as we were telling, that is very much required. So here again, early signs is like fever, chills, cough, shortness of breath, and all this, pneumonia and other things. These are some of the symptoms. So, what we need to take? Antimicrobials suitable for likely pathogen, because for virus we don't have direct medicine, because you need to improve your immunity. That is first thing. I am not suggesting, but mostly vitamin D tablets or omega-3, even citric acid related vitamin C related tablets. Like that, things were taken, multivitamin tablets, all that. So these things helped the immunity. Second thing is for fever, like paracetamol, that was preferred mostly. I'm telling some earlier our experience, and one antibiotic they were taking, recommended by doctors. So this was the routine. So many people have become doctors by themselves, having watched people taking this kind of tablets to suit at already corona. And here oxygen is very, very important. So we have oximeter. With that, by measuring oxygen levels, we can know easily 95 or around 95 and above is better always. The percentage of O2 in the blood. And having a thermometer is also helped a lot. So here again, people with kidney failure or diabetes, they need special treatment. So here again, not responding to escalating supplemental oxygen therapy requires advanced respiratory interventions. They are also given. So then septic shock, treat with intravenous fluid therapy and Aspro. These are for doctor level. All this also we might learn, but doctors who are following all this. And compounds already licensed or in the development for other diseases may need to be repurposed for emerging respiratory virus infection. So this, especially virus mutations are happening, and they are also developing immunity. So vaccines are effective, but again, taking another dose and another booster dose like that, I think this thing is a continuing process. Many have taken already 3 doses of vaccines, but with new variants, we don't know whether another new vaccine is going to be developed or the old vaccine is okay for us. And again, monitoring is required. Then getting tested for finally RT-PCR test is one thing which will tell. Here we have the final quiz. So here you see in this quiz, when triaging patients at healthcare facilities, masks are required only for patients with a confirmed infection. That is false. Everybody requires a mask in that environment. What type of infection control precautions are required when performing an aerosol generating procedure such as bronchoscopy or a patient with suspected or confirmed illness? So contact precautions and airborne precautions are required. So there are 2 questions here. So that's all. So once doing all that, I will share. You might have seen the certificate, how and where it is to be downloaded. Here, once you get here, you will get to the certificate. So you'll also get an open badge. So this is the badge you get. You can post on your social media, like successfully completed openwh.org. You can download this badge and post it in your social media. And certificates. So you see record of achievement, and you can download your certificate like this. So you see certificate will be like this with your name. So I completed on December 22nd. So date also comes, and there is a QR code. It can be verified, so it cannot be a duplicate certificate. So in your account, always this certificate will be there. You can always download. Yeah. So that's all. Within 1 hour's time, you can get your certificates. I want all of you to get your certificates and post it, share it in your respective groups. And once you are done, then we can go ahead with the other important courses. And as we are dealing with this corona or sustainable development goals, including climate change, some of the biggest things. And we have nearly 150 courses in these 3 areas. We already have completed 3 courses successfully. Introduction to climate change and children, climate change and human rights. Those videos are available. Those who have joined today, newly. You could go through those videos and complete them. Thank you very much. Thank you, everyone. So any questions or anything, you can post in chatting. We'll see later and we'll communicate in your groups. Any problem, you can directly contact admin members in your respective groups. We'll assist you. Thank you. Thank you, everyone.